Hello, my name is Dr. Jack. Thanks for joining me on this video. Today we'll be discussing the newest class of weight loss drugs that has hit the market in a big way, and for good reason, as the results when it comes to weight loss are quite profound. Given the popularity of these weight loss drugs and the fact that I am seeing more and more of my patients on them, I figured I would do a deeper dive and learn what I can about it, and this is me sharing all that data with you. We will address how this class of medication works, insurance coverage, who should take it, potential risks or downsides, and much, much more. So without further ado, let us get started. Let us begin by briefly talking about why this class of drugs is a big deal. Today in the US, about 70% of adults are overweight or obese, and many of them have serious health problems contributed by that excess weight that puts them at much greater risk of things like stroke, heart disease, diabetes, certain types of cancer, as well as fatty liver disease. Currently, fatty liver is a leading cause of cirrhosis. Studies have shown that losing 5 to 10% of body weight through diet and exercise will reduce the risk of cardiovascular disease in adults. And there is some evidence already that people with type 2 diabetes that take Ozempic improve their cardiovascular health. The average person taking these GLP-1 like drugs that we are talking about here has shown an average of 12 to 15% drop in body weight. In other studies, it has been shown that if someone is obese and is able to lose 5 to 7% of their weight, you can significantly lower blood pressure. This in turn causes less stress on the heart and blood vessels, leading to decreased risk of things like heart attacks and strokes. These drugs have the potential to move the life expectancy up in areas that have an overweight population. So how do they work? They are GLP-1 based therapies, which is short for glucagon-like peptide 1. GLP-1 is a hormone that your body makes naturally. GLP-1 receptors are present in the pancreas and numerous other areas of the body. It has multiple effects, such as reducing inflammation, assisting with nerve growth, improving heart function, and in regulating lipid metabolism. It has even been tied to the central nervous system, reward pathways, and possible effects on drug use or impulse control as well. It has also been tied in with depression and some symptoms of schizophrenia. So stay tuned, as I believe that more of this will be discussed in the future. The weight loss aspects of this hormone work by increasing our body's insulin release, hence why it works well in type 2 diabetics. It also slows your stomach's emptying and therefore makes you feel full for a longer period of time and prevents you from feeling hungry. All of this leading to less consumption of quote-unquote food. I use food in quotations because I consider food something that nourishes you, and unfortunately, our so-called food industry is allowed to put out products that offer very little to no nourishment and is only designed to get you addicted to their product, and the focus is your brain's reward system, and they get there through your taste buds. But I'm sort of getting off topic here. Originally, GLP-1 drugs like Ozempic and Trulicity were used to mainly treat type 2 diabetes, but people noticed that patients were losing weight as a side effect. Therefore, it was only natural to start focusing on its weight loss capabilities. One should know that both the common trade names of Ozempic and Wegovy are the same drug called semaglutide. The differences are that Ozempic was approved in 2017 for people with type 2 diabetes, and Wegovy was approved in 2021 for weight loss. One can qualify for Wegovy if your BMI is greater than 30, which is a criteria for obesity, or a BMI of 27 if there is also a weight-related condition present like hypertension. Just to give you an idea, BMI of 30 is someone that is 5 foot 9 inches tall and weighs about 203 pounds. There are all types of calculations online that can measure your BMI for you, and BMI is a calculation of your body mass index, taking your height and your weight into consideration. We should also discuss Mounjaro, which is FDA approved for type 2 diabetes, but not FDA approved yet for weight loss. It could become the most popular of this class of medications, as it has shown to help a typical person who weighs about 230 pounds lose up to 50 pounds during a period of 17 months. This is a big deal because no other weight loss drug has ever been able to safely show this effect. Mounjaro has a GLP-1 effect, but also promotes a second gut hormone known as glucose-dependent insulinotropic polypeptide. Try saying that real fast. Or GIP for short. That also plays a role in many ways for weight loss as well. All of these drugs currently only come as an injection once per week, so if looking at this image raises your heart rate, then this class of medications for weight loss may not be for you. So let's talk about the downsides. One is the fact that the most popular GLP-1 medications are injectables currently, but there are GLP-1 drugs that come in pill form, and you have companies like Pfizer working on a pill that works the same way as the injectables with similar weight loss results. I suspect that in the future, the oral form of the drug may be more popular and cheaper, which brings me to the next topic of cost. Cost is a huge issue. Ozempic runs about $935 per month, with Wegovy running closer to about $1,300 some dollars. Insurance coverage for these drugs can be difficult at times, and this tends to be a problem because if one cannot afford to stay on the drug and purely relies on it for weight loss, it has been shown that the weight gain comes back very quickly. So far, drugs like Wegovy and Ozempic are usually excluded from insurance coverage. Medicare and Medicaid generally do not cover them, and employer health plans, which cover half of the United States population, typically do not cover weight loss drugs either. However, if looking at long-term costs of all the health issues that obesity brings versus paying for this drug, the cost of the drug may be cheaper in the long run. But currently, your insurance would rather you go under the knife and get gastric bypass with all of the associated risks of having surgery than pay for you to take this medication. Most common side effects involve nausea, vomiting, constipation, diarrhea. Some complain of headaches and fatigue as well as dizziness. These side effects can subside over time as your body acclimates to it, but can be severe enough in rare instances that people discontinue the drug. There is a risk of pancreatitis or inflammation of the pancreas in earlier trials, but later studies and clinical experiences has shown that this is of little concern, but it's still worth paying attention to, especially if one plans on taking it for a prolonged period of time. Thyroid tumors are also a concern. There have been studies that observed increased risk of all thyroid cancers, especially if taken consistently after 1 to 3 years. And this has been shown in animal studies as well. So people with a personal history or family history of thyroid cancer should be cautious when taking these medications. So this is the part where I have to tell you that this is just my opinion and not medical advice. To me, everything in life must be weighed with a risk-benefit profile. If someone has truly tried to eat and drink right, exercise, and intermittent fasting, which I am a huge fan of and seen amazing success with patients, and they are truly considering, say, getting surgery to reduce their weight, then I would talk to your doctor about considering this line of treatment with GLP-1 medications first. And if you have type 2 diabetes and are overweight, which the vast majority of people are, then this is definitely worth considering. The biggest issues right now is affordability, and that we do not know the long-term safety data if someone is choosing to be on this drug for many years. But what we do know is all the health implications of being overweight and what it does to both health span and lifespan. So one must work with their doctor in determining what is right for you. And then if you start this drug, make sure you have a long-term plan to get off of it. As you are being titrated up on the medication over a period of weeks to months, learn about nutrition, learn about your habits and how you change them. There's this great book by James Clear called Atomic Habits that is an amazing read that I highly suggest. Learn about intermittent fasting as well, but if diabetic, be sure and talk to your doctor first, as you do not want to bottom out your glucose, as that can be dangerous. There is a great book that I suggest to my patients by Dr. Fung called The Complete Guide to Fasting to get you started. You must make the necessary lifestyle changes, as no one is going to do it for you. I always tell my patients that I am their biggest fan and cheerleader, and that I am rooting them on because how you choose to treat your body starting in your 40s will determine not just your remaining quantity of life, but also the quality. I know that no one wants a life of increasing pain from the excess pressure on their joints and spine, as well as taking many medications for all the health issues that begin to pop up later in life. So nourish your body and mind as you only have one. So we'll go ahead and wrap it up here. As always, if you enjoyed this video, then please hit the like button for the YouTube algorithm and share with others that may find the information valuable. If you like my content and other of my videos, then please consider subscribing with the notification bell on so you know when my next videos drop. I don't have much time these days to make videos like I once did, but if I find a topic important enough, I promise that I will. So until next time, take care. Stay safe. Bye-bye. Pura Vida.